Before my normal introduction, let me show you two pictures of people who went to today's session that's going to be part of the topic of getting out of the comfort zone, along with a pleasant surprise from a fellow death doula who appreciated one of my books. Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse with extensive hospice and palliative care experience, and I'm a newly certified end-of-life doula through the International Doula Life Movement, also known as IDLM. I like to refer to myself as a life transition coach. If you're new to this channel, welcome. Thank you for taking the time to visit. In this channel, we talk about death and dying because death should not be a mystery. We are all going to die, and I believe that with proper support, education, and knowledge, that we're not going to be as afraid of death and dying as somebody who doesn't know what the process looks like. We'll have videos for my fellow hospice and palliative care nurses, videos for my fellow caregivers, my fellow end-of-life doulas on this subject matter. If this is something that you appreciate, please subscribe to help support this small channel. And if you like this video, please do like it. It really helps the YouTube algorithm. So the topic of today's video is pushing forward. This is for my end-of-life doulas, my fellow doulas, is pushing through to get out of our comfort zones, not allowing yourself to be stuffed in a box. And before we get to the topic of today's discussion, I always like to encourage all of my listeners and viewers to practice at least one of the pillars of building resilience. So resilience is the ability to snap back in the face of life storms and crisis. We never know when we're going to be hit emotionally. It could be anticipatory grief, somebody's dying that we know, and it doesn't have to be a person. It could be a loved pet that we have. It could be a loss of a job. It could be a loss of something that you treasure. We all go through different types of grief. And if we're not resilient, we can get to very dark places where we think about suicide. And I believe that if we can build up resilience, it's not that we're immune to the emotions that happen around us. We don't become Mr. Spock from Star Trek, the Vulcan, who there is no emotion, there's only logic. But when crisis hits, when these emotional battles come upon us, we're better prepared. And for me, there are three pillars. There's my faith in Christ Jesus. There's working through forgiveness. Who do I need to forgive? And then there's the third pillar that I encourage each and every one of my listeners and viewers to participate in, and that is, what are you grateful for? Ask yourself that throughout the day. It can be extremely hard, especially if you're going through a storm. Maybe you just lost your job, or maybe you received a terminal prognosis, or maybe you were fighting a battle against a chronic illness and you were finally labeled, and I'm not a big fan of labels. And that has you down. It can be very difficult to be grateful. But it's finding those things that we can be grateful for and expressing gratitude that, to me, helps build resilience, because we could focus on the hope. Like, if this happened to us today, if this happened to us yesterday, there's hope in the future. And so in terms of what I am grateful for, some of it's going to be a part of today's discussion. I am so grateful for my fellow classmates from cohort 25. I apologize that I cannot list off every class member. My short-term memory is like a butterfly. I write books, and yet I'll have to pick up the book. What did I call the title of that book? That's how horrible I am. I don't envy any of us who go through short-term memory loss. But Anna Adams, the founder of the International Doula Life Movement, and she was the primary instructor through cohort 25. I did have the opportunity of teaching one of the classes. I so much appreciated that, and I'm looking forward I'm now part-time working, and that's another thing I'm grateful for, is I'm now a part-time instructor, mainly for the community education, for the continuing education, I should say continuing education. Get my mouth on right. I already did one on hospice eligibility, and on Thursday July 24th, 2025, 7:30 to 8:30 p.m. Eastern Standard Time. I will be doing a 1 hour presentation. It'll be 40 to 45 minutes of information and then 15, 20 minutes of questions and answers, looking at how dementia is different for hospice eligibility and how end-of-life doulas, and if you're one of them, how we can help the family and hospice, how we can get them on board at the hospice if they're appropriate, how we could educate the family through the process, and if the family says no, how we could still be there throughout. And then also, how do we communicate to that loved one with dementia who is asking to go home or asking to be with their mother or father or repeating things over and over again? How do we deal with those in a loving and compassionate way? And so that's Thursday, the 24th. It is free for students of the International Life Movement. You take any of their classes. They have a number of different classes that they offer. I took the initial death doula class. They have an advanced doula class. They have an advanced life planning class that I'm taking that's from August 12th to October 16th. They have a pet doula class. They have different grieving class. It's just an amazing group of people. And again, I'm going to name some names. If you're not named, if you're part of cohort 25, please forgive me if I don't mention your name. I'm not picking on certain people because I think of them more highly than others. It's just certain names stuck better in my mind than others. There's Kat Good, who I had the opportunity to be in a breakout room yesterday. That's part of with IDLM. I'm going to live session, so this is not a dry pre-recorded webinar from several years ago. This is current. This is current, and in fact, of how current it was for yesterday, our last class, they gave a case study, and Anna threw us for a pleasant loop. It was kind. It was kind from the perspective that when we get out there in real life, we don't know what we're walking into when we open the door. We could take that intake call and get all the information in the world and walk into the house or trailer park or facility, and everything is different than what's described. So here we had a case study that was in our portal for class, and it gave, like, this is the husband and wife and what the husband's in denial, and gave all the background and everything else, and gave some real hard questions for us as doulas to work through. But last night she said, I know all of you had access to that, so we're going to come up with something different that we didn't have a chance to study for, and presented us. And we went into different breakout rooms, 2 to 3 people in a group, and it was just an amazing experience to walk through and be able to paint a picture and manage our time effectively through that. So I was in with Kat Good. But then there's Melissa Meadow, who's also a funeral director. We get a wide, diverse group of people. Kat's a CNA. Melissa's a funeral director. There's Michelle Stewart, who's a registered nurse with extensive experience in the psychology element and also working hospice and palliative care. There's Bethany, who I believe is a CNA. We have Haley, who is one of several of our loved students who has no medical background whatsoever. If any of you are looking for schools, you do not have to have a medical background to be an end-of-life doula. I'm not going to lie to you, it helps to have a medical background depending on what that background is, but it's not a requirement. And the plus side for the International Doula Life Movement is it walks you through everything that we can get connected with. It walks you through palliative care. It walks you through hospice care. It walks you through the dying process. Yes, I know it more intimately as a hospice and palliative care registered nurse, especially somebody who's been there numerous times when a loved one took their last breath. But that just gives me that much more of an edge that if you push yourself into this and you embed yourself into the training that they provide, my edge becomes nullified. So it's not like, ooh, Peter's better. I'm not. It's a very wonderful program that just helps everybody be on the same level playing field. I'm not stating that I can't offer to do more, which I can. I had a conversation with one of my Facebook friends, Rachel, who was saying, I didn't know that a registered nurse could do registered nursing services while they are a doula. And the answer to that question is yes, as long as we're transparent as to what service falls under which umbrella. And there's many services that a registered nurse can offer that do not require a doctor's order. There's a lot of misinformation, misunderstanding out there that a registered nurse always has to operate under a doctor's orders. No, I can't prescribe medications. I cannot give a medical diagnosis. I can, because of my hospice and palliative care training, I can give a prognosis. I can give recommendations. You remember the situation background assessment recommendations. I can give recommendations and I can certainly educate. I don't need to have an order in order to educate. No pun intended. So we have so many classmates. There's Rebecca. Oh my word. I'm going to switch screens because I have a list of people I don't want to forget. There's Miranda, Miriam. Oh, Miriam, if you ever watch this, uh, every one of our classmates brings forth a beautiful, loving personality. Miriam is the questioner. Miriam is the questioner. She'll be the one, I have a question, I have a question. Now, in the very beginning, and as I share this, Miriam, I platonically love you. I am in the autism spectrum. So I'm autistic, high functioning, uh, sometimes very problematic when I have panic attacks. But I like patterns. You know, if you ever watched The Big Bang Theory, Sheldon and I could probably compete on some things. And I'm not claiming to be as intelligent as Sheldon claims to be. But when patterns are broken, you know, stress bubbles up. But here I've learned that Miriam asks meaningful, wonderful questions that really enhance learning for everyone. So thank you so much, Miriam, for every question that you've ever asked. It took me some time to get used to all of the questions because it breaks the flow. But as I got used to Miriam and there are others that are similar, the learning is so much enhanced. And again, I cannot speak highly enough of how IDLM is different because there are a lot of schools out there where you pay a certain amount and then, and I'm going to use the word fed for lack of better words, but you're fed webinars. You're watching pre-recorded. This is a pre-recorded video. I'm recording this on Thursday, July 17th, 2025. It's going to air on July 18th, hopefully at 9 a.m. But this is pre-recorded. So you can't interact with me. You can comment in the link below, non-judgmental channel. I'll do my best to answer you promptly. But there's no human interaction. So here, our groups, there are times it's supposed to run 7:30 to 9:30 Eastern Standard Time. There are times we're not finishing class until 10:30. Now, if you have to leave, you leave, and they'll cover the meat of it by 9:30. So please don't think, oh my word, I'm never going to be able to get out of class if you have tight time schedules. But there are times where we'll be going on long after the class that you're not going to have in another school, that it's all pre-recorded, old, outdated information. This is up to date, live, up to date. There's Amber, and Amber, I'm not going to, I'll try Nikolai. I'm probably killing your last name. I'm sorry. Barbara McNair. I think she's auditing a class. She's already graduated at least once before. That's the other beautiful thing. If you're IDLM, and by the way, if you didn't guess, we are into today's topic because it is going forward outside of your comfort zone. But Rebecca, Jackie, Catherine, you have two Catherines, one with a C, one with a K, Marnie, Margaret, Cynthia, Ryan, Kate, Robin, Christy, John, and I may have named some people that's auditing versus part of the cohort, and there may be people I missed, sorry. So last night we finished up. I did take the final exam this past Tuesday. I passed. I am a geek, so yes, I got 100%. I'm happy though. It was like, and I know my wife is like, was there any doubt? Well, yeah, I have test anxiety even though I do well. So, but I'm so grateful for that. So talking about pushing forward, and I know I mentioned that in part when I said that this is our last class. So in terms of pushing forward, get out there, even when it's uncomfortable. So this past Tuesday, and I'm going to go over 2 days, Tuesday and today. So this past Tuesday was business breakfast. So I've been going for the past couple business breakfasts. And for anyone who knows me personally, I am an introvert. I am an introvert. If I am under stress, and this is maybe my autism, I have panic attacks. And I'm going to be vulnerable in terms of sharing with you a little bit what that looks like. So last Saturday, I had signed up for July 12th to go out to Century 21 Pinnacle that's right next to Just Love Coffee to help make beds for those who need beds made, young children. And so I figured I'm not in a position at this point in time. My wife and I do donate to a lot of charities in Madison County, Kentucky, but we're at our limit for our monthly donations. And I figured if I can't give monetarily, I can give up my time. So I made sure that the alarm clock, I got up early, got everything ready, and I had everything. I am a overcompulsive planner. So I'm like, on that Friday before the Saturday, I go for a Friday men's breakfast. I'm walking out and I'm walking over to Century 21 Pinnacle, looking at their parking lot, like planning where am I going to park. Yes, I am that down to the minutia. Even for today, we're going to talk to when we get to Thursday. I'm looking at Google Maps and going down the road and what does this look like? Because while I passed the place that I went to today, I didn't know where to park. And parking, I'm the idiot that like parking is like very crucial. So I got up on time. I left on time. But when I got there, and parking was so tight that like it was like I felt like a sardine. Like, am I going to be able to get out of the car? And when I saw that there were more cars coming in and I looked over at all the people that were outside, my introversion, my shyness, my call it autism spectrum, I literally had a panic attack in the car. I literally felt like a 2-year-old or 3-year-old child. I'm being transparent with you. And then I ended up finding the safest way to pull out without creating an accident. Came home and felt very embarrassed about the situation. So Sandy, by the way, if you're watching this, I'm sorry that I let my introversion, my shyness, my panic get in the way. Um, I've worked through that in the past, by the way. For Ben, if you're watching, am I going to have a panic attack in March of next year? Um, I don't think so, because this is what I'm in my comfort zone, and hospice and palliative care is my comfort zone. And I'm already planning to be around more people than I could probably tolerate. So I'm already working it in my head, but I forgot to work through that in my head for Saturday. I thought it was going to be a small group of us putting things together. I did not anticipate, my bad, the turnout, and I let it get to me and I let it break me. And that's something I'm working through. I'm just being vulnerable with you. So, but Tuesday I went to this business breakfast and I've been making every one. And I've been working on my elevator pitch. My name's Peter Abraham, hospice and palliative care registered nurse. I help nurses, caregivers, and family members provide better care with less worry to those who are chronically or terminally ill, and period. And so I've been working on that. But here, as I get there and I'm in the room and I notice everybody's going and they're talking with one another. And I know Miriam, if you're watching, she shares, she's the social butterfly that, she could talk even if people are in bathrooms doing their business and have full-blown conversations. And I'm not there. And so, but I just, took my seat and I watch and I observe and I listen and I soak things in. And I'm thinking to myself, I am probably the only introvert in this room. But I didn't get up and go, even though there was a part of me, just you don't fit in at all, get up and leave. I stayed. And then when they went around the room for the introductions, the person that did the introduction before mine reminded me of a very important lesson that I have to think about, and I've not, it's on my mental to-do list. It has to make my to-do list and actually get done, hopefully, before the next meeting. But he shared concisely who he was, who he worked for, and what he did. But then he said a good referral for me is, and gave a very, very concise, what would be a good referral. I'm like, that was amazing. But then it's my turn to speak, and I gave my spiel, and awkward as it is, but it's getting out of the comfort zone. So that is moving slowly. But in terms of like, I didn't expect this to happen. And this was another one where, as we got closer for me leaving, I felt the pressure to just stay home. I'm being transparent, I'm being vulnerable. So today, the Berea Chamber of Commerce hosted a small business development educational session. They did a, I don't know if they'll let that, there we go. Katie Startzman did a lunch and learn at Native Bagel in Berea, going over how the SBDC helps small businesses for free. Like if you need to form your LLC or corporate, whatever business formation you want to do, there's state payments to make. The cost for the SBC coach to walk you through and help you with all that paperwork is $0 and zero. I don't know what the symbol is for $1 in my hand. So, but it's free. And so after this lunch and learn, I went up to Katie. Here's my business card, because I'm questioning. I did a multi-member LLC, but in practice, not that my wife can't make decisions, but I'm really the one operating and running Compassion Crossing LLC. Will I get, like when it comes time to do taxes, will I have to file partnership paperwork versus the sole proprietorship? Does that complicate things? Because I did multi-member, even though like I'm 100%, my wife is 0, and I don't mean that in a demeaning way. But I have questions about that. I have questions about contracts and agreements, and if I want to do sliding scale pricing, which is my desire to do, and be able to take donations even though I'm nonprofit, and then also for messaging. So I gave her my card, and she's going to reach out to me. But here, as it got closer, I knew I had to leave shortly after 11:30. Now this is obsessive compulsive planning me. This is a 8-minute drive on Apple Maps. It's 10 minutes with traffic. But I left at 20 to 12 just to get there, because I never, even though I looked up parking, like what was that experience going to be like, and getting in, and they did forewarn, come early, you might not get a seat, and it was packed. So I was pleasantly surprised. But as it got closer to the time, it was like that pressure of, I have so much that I could be doing here. I need to get 11 more articles to complete the year. I have articles written in advance of publication for compassioncrossing.info. I'm already filling up December of 2025. I just have 11 more articles to take us into the first week of 2026. I could stay home. I can work on that. Or I need to work on my next book idea. I love writing books. Let me work on that. And so all this thoughts going in my head, but me staying home is not me getting business as a doula. Me posting on social media is not enough. If that's and some of you, that may be your only venue because maybe there's no local things that you can go to. So as I share this, I'm not sharing this as a non-judgmental channel. I'm not sharing that this is the only way, and if you don't do it this way, you're doing something wrong. I am not anyone's judge. But I do believe that in order to build your business, you have to be a part of the community that you serve. You have to be a part of the community that you serve. So I went, and I got there, and again, the introvert, I'm being transparent. Everybody's coming in, everybody's talking to the people they know. What further complicates things in my situation, aside for the introversion, is my wife and I moved to Berea, Kentucky late last year. And we really didn't get out into the community for a while. We were told that this was the worst snow season ever, like I shouldn't say ever, 9 years in Kentucky. That'll be our excuse. But like there were church services canceled and a lot of other events canceled just because of the weather. So I don't know people. So here people are going and they're talking and they're shaking hands. And yes, I could be shaking hands and introducing myself. But if you are a fellow introvert, that's scary and hard. So I said, I'm not going to push myself yet for that. But I found myself a seat, and actually, in order to, like they tell you, like if you do public speaking, picture the audience nude. By the way, that doesn't work. Uh, it doesn't work for me at least, and I don't want to go down that road of why. And it's not lust, by the way. It's just I am very different for how I view life. And so it's like the one science fiction movie where if you wore certain glasses, you saw the alien in their skeletal form. So just give you an idea. And I'm not saying I see people ugly either. So please don't read into that. But think of something humorous was the goal. So I'm thinking, I'm going to find a nice place to hide because where would you first go? So I picked an end table in the corner and figured, okay, I'm going to position myself. I can see and hear the speaker, and I could watch and observe. I could people watch and I can listen. Um, and I also find, as a side note for my fellow end of life doulas or those considering, don't we have to listen? Don't we have to become extremely good at active listening? If all we're doing is talking and all it is about me, am I listening? Am I hearing? So I'm not telling you don't network. Please don't read into what I'm saying. I'm just saying I figured that's where I can compromise where I did go, and I'm now in my comfort zone in the corner. But I cannot testify enough on how good God is, and I'm not saying that to preach to any of you. But here there were three ladies that came in that when they were asked, what do they do? Where do they work? They work at CHI St. Joseph's in Berea hospital that is like 3 to 5 minutes, maybe 5 minutes if traffic's heavy from where I live. 5 minutes from home. And they go and they sat down on the table next to mine. Now the three of them were talking, they were like this with one another. And if you've ever been to events, one of the lessons I learned, if you're the fourth wheel or the fifth wheel and you try to insulate yourself into somebody else's clique or group, it's like, to me, it's like throwing the dice as to whether that backfires in your face. So I just watched and observed and had a smile on my face as I listened, and I was hearing the different ones talking. And then there was another nurse from Baptist Health that sat further down the line. And so here, when it came time for this group to start the presentation, it's lunch and learn. So it was like, we sat down, had some opening conversations, and then they said grace, and then everybody come up and get your portion and sit down and eat. And I went last for a number of reasons. I'm a multi-reason person. But once everybody was done eating, they asked everybody to go around the room to introduce themselves, give their name and just a small tidbit. And thankfully, from all those it's every third Tuesday of the month is the business breakfast. So I've been to 3. I was able to give a very concise, I didn't do the referral part, but a very concise statement of I'm a hospice and palliative care registered nurse new to Berea, and I started Compassion Crossing to help both organizations and individuals facing chronic and terminal illness. And it went around the room. And then there came a small portion before the main speaker started speaking where Andrea from CHI identified herself. Sorry, I didn't, you're sitting right next to me at this other table. I didn't introduce myself. So she asked for my card and I introduced myself. And she said, we need, I gave her my card. She goes, we need people like yourself. I'm going to keep this and share this. And then it went around, and here at this table, one of the persons there was a chief officer of nursing, and another person, and I apologize for this lady, I believe her name's Rhonda, who was in some type of leadership managerial position in cardiovascular health. Again, my short-term memory, and they didn't have cards, and I didn't ask for cards. They may have had cards if I would have asked. But here, after the presentation was done, and we're breaking up, the cardiovascular lead or manager, clinic, again, I do not know the exact position other than higher up in management, came to me and asked for me for my card as well. And she said, I'm going to be giving your card to the case managers in the hospital. We need people like you. So that's one that I'm grateful for. And time will tell what happens with this. Now, if you're an end-of-life doula and you're watching this, and you're saying, Peter, that's great for you because you're a hospice and palliative care nurse. To a point, I do my best to be transparent. And I'm not saying, I'm not replying in this to like argue with you and get in a battle with you over mincing words and who has to be right and who has to be wrong. To me, it's about relationships. So there's certain portions I do have an edge. But that edge is small. And if you let my edge get in the way of what you have to offer, no offense, that's on you because you have a lot to offer. You have a lot to offer. Because maybe you're not the introvert like me that's scared like me and my one puppy, Bonnie. Bonnie's scared of her own shadow. I move the one chair and the sound, if it squeaks the wrong way, Bonnie, boom, out of the room. We walk her and she sees somebody's coming. She's literally circled my legs and tried to crawl up. We're like this when it comes to anxiety and being afraid of certain situations. So maybe you're not that way. Or maybe you are like me, but you have a different way of wording things that put things in a better perspective. Or maybe you're serving a certain element of the community that I can't serve. Not that I don't want to serve, by the way. I'm not, I want to be very clear. I do my best to never discriminate against anyone. It's just from my standpoint, when I try to help certain people who have certain beliefs, if they query me and I answer them transparently, they don't want me. And that's their right that I'll never take away. But because of that, I get hesitant of trying to serve certain groups because if it's not that they're kicking me in the mouth, so to speak, and that's how I lost my teeth, but I don't want to offend anybody, nor do I want to have mud or food or anything else thrown at me, so to speak. So I'll do my best to help from a distance in certain areas, if that makes any sense. But there's a need for end-of-life doulas. So at the time that this is going to be publishing, this video is going to be publishing on Friday, July 18th. There's going to be an article coming out on compassioncrossing.info talking about the caregiver crisis that's happening in America. It has been happening over the last few years. It's accelerating through the roof. It is exploding. There is a caregiver crisis in end of life, and families are suffering beyond measure. And part of the solutions, hospices needs to be part of the solution. But if you're an end-of-life doula, you are part of the solution as well. You are part of the solution as well. You are needed. You are needed. Casey, one of my Facebook friends, she's been an end-of-life doula for a number of years. She put it on her LinkedIn page on Wednesday, July 16th, that she had the opportunity to do a presentation to an oncology department at a local oncology department at a local hospital, for why end-of-life doulas are so needed and how we help. So get out there into community, get out of your comfort zone. When I went to this small business development lunch and learn, I did not know what to expect. Yes, they had a little bit of an agenda, but it was like, wow. And what's also happening is there's certain people that go to these events that are cornerstones, landmarks in the community. There's Sandy Adams, who is part of Century 21 Pinnacle and Just Love Coffee, that she is doing everything that she can to, within the realms of values, ethics, morals, and her own statements. I don't want to put words, if you're watching this, Sandy, I don't want to put words in your mouth, but she's doing what she can to help everybody collaborate as business in Berea in Madison County. So she goes to these events on a regular basis. There was Donna Angel, who is the one of the leaders in the Berea Chamber of Commerce. She goes to these. And so there were different cornerstones, landmarks, solid members of the community that goes to these types of events. And what happens when they see you and me and people like us going to these events too? They may not have need of our services today or tomorrow, but the more that we're out there in the community, because who do end-of-life doulas serve? I mean, I realize some of us are virtual. Mallory, if you watch this, Mallory and I have done virtual. I'm still doing virtual now. I don't have a virtual client now, to be specific. I've been on and off. I don't know if I want to say I have them as a client, but I've been on and off with a lovely lady in the U.S. that's really going through suffering and trying to do VSED, voluntarily stop eating and drinking, which is a very challenging, emotional, what a dilemma for somebody to be in. And I've been trying to help on and off as I'm able for free for that. But there are those that do virtual. But if you're not virtual, you need to be out there. And I'm using need for my word. You do you. But I do believe you need to be out there in the community, because that's who we're serving. That's who's going to be calling us to provide service. This is a hospitality industry. This is a service industry. So we need to be out there. And when I talked to Donna, she asked me, how things are going, and I'm sharing transparently. Right now, the largest portion of the business is growing, and I'm grateful. This is part of my gratitude story, is the healthcare organization side. The Visiting Angels of Richmond, Kentucky, thank you, Rhonda Martinez, has been amazing. They had me come out and do a presentation on hospice and palliative care, anticipatory grief, disease processes, trajectories, and then recently helping them walk through there's lots of steps for any agency that wants to apply to be able to receive Medicaid as part of the waiver program. It's called HCB, at least in Kentucky. There's a lengthy process to go through in order to be an approved agency, to be able to say to family members, our caregivers can come in the home, and at least a portion of what they're getting paid is going to be coming from Medicaid. That takes a lot of paperwork. There's a lot of connecting the dots. And so I put together a 7-page step-by-step, including websites, phone numbers, directories, timeline estimates in terms of SMART goals. If you don't know what a SMART goal is, specific, measurable, attainable, realistic, time specific. So here's what this process looks like. So that's where I've been getting most of my business today. There's Jose Escobar, and this is not even an advertised service. I helped him with the Polaris Consulting Group get a book published on Amazon .com through KDP. Now he did all the work. It's his entire copyright, just giving transparency. But I've been running into, how do I message hospice? When I talk to hospice nurses individually, they got the message, but I'm still having a challenging time for getting the message to hospice leadership that we are part of the ecosystem that boosts them up. So if any of you work in, I'm trying to think of analogies. You may have heard the term boost up team members. You know, if you have somebody coming on to replace you in a shift, you want to introduce them in a way that boosts them up so that the person that's receiving them uh, feels more comfortable that they have somebody that's knowledgeable, wise, experienced to provide care or service. So I strongly believe that end-of-life doulas, life transition coaches, that we boost up, we uplift hospice and palliative care. We don't replace, we don't compete, we collaborate, we refer people to hospice and palliative care. So on one end, the message should be simple. We're a referral source, but trying to get in front of the right people can be challenging. So I did share that with Donna, and that's something that I'm hoping that Katie Startzman can help me work through. But this is where we're coming to a close for today's discussion. Is it, if you, number one, if you're looking for how, I want to be an end-of-life doula. This is an exploding industry. I want to be one. So I want to cover 3 points just on that regard. One, this is a calling from the heart. So if this is from your heart, that's the main qualification that you need, the main. Number two is there are books, and I'll be putting in the links below for several of my books. There are books on how to become a death doula. I wrote two. There's the Foundation of Practice, and there's a Business Growth, and then there's a combined set where you can buy one book that has both of them in one. And there's places like the National End of Life Alliance. By the way, I've not yet been able to take my test due to a PayPal issue. That PayPal does not accept my valid email address as being valid. But there's different ways to become certified, which is basically a graduation certificate. It is not the same as a high school graduation certificate because high schools are governed. It is not the same as a hairdressing certificate. It is not the same as a dental hygienist certificate. These are governed bodies. Nursing's governed body, accredited schools. That's one of the fine print. But if you're going to go to school, and none of my books replace the school, I cannot endorse the International Doula Life Movement enough. And then the third thing, because I said there are three, there's one, your heart's the main requirement. Two, there's resources like books and schools. I recommend IDLM. And then the third component, and this is what I think is the biggest challenge for everyone that's out there, at least some of us, if not many, is we charge to guide people in these dark times. It makes it kind of feel uncomfortable charging to help somebody deal with grief, death, dying. But it is a business, and we do need to earn income in order to provide for ourselves and or our families. I don't want to use the word living wage because I've yet to find a person who could define what does that really mean in universal terms. And if you want to comment, I don't want to get into that argument because it usually doesn't end well because most people that employ people are small businesses, not the Walmarts, Targets, etc. So I don't want to go down that rabbit trail with you. But we have to charge a fair price. That could be very difficult for us to do. It's a private practice. I had a fellow hospice and palliative care nurse who shared with me that they're looking at giving their notice for what they're going through at their agency, and they're feeling like if they're being pushed to do 12-hour shifts 5 days a week or 4 to 5 days a week, they might as well do it at a hospital where they get 4 days off for putting in 3 days. But she was asking me about becoming an end-of-life doula. And I'm like, the one thing is you're giving up a paycheck that comes in, you know, if you're paid every 2 weeks or however your paycheck comes in, you're giving up a steady paycheck to where you, as the business owner, this is your business, you as the business owner are generating, that's part of why you get out there in the community, you're generating the income. And if you're not generating the income, you're not receiving money. And I do know there are some hospice agencies that will employ an end-of-life doula, but if you're looking for that, I like doing reality. The percentage, I've not done a statistic, I don't know the statistics, but my gut feeling from everything I've been seeing, from hearing from Anna, the number of hospice agencies that hire end-of-life doulas is a very low percentage. And then there's the catch-22. Part of the reason that there's an explosion of end-of-life doulas worldwide, it's been going bonkers in Canada and Australia, but it's also growing in the United States, is that hospice is so regulated and becoming so monetized. And not, keep in mind, we do have to get paid, so I'm not trying to, you know, shoot the dollar that you need, but they're getting a push for more and more people, see more and more patients in and out, in and out, in and out. Well, one of our blessings that we give to our families is that while if we're one person operation, we can't be there 24/7, we may not be able to be there 12, but we could spend more time than the typical hospice nurse, chaplain, social worker, CNA, all of them combined. And so if you work for a hospice provider, they're going to be telling you, you could only spend so much time with the family. And over time, they're going to be telling you what to tell the family and what not to tell the family. And they're going to tell you how to advocate, what to advocate for, and what not to. And that becomes the ethical dilemma, because I still remember vividly June 14th of 2024, where literally within seconds after hitting the send button for my lung cancer patient who was in her last 2 weeks of life, she was transitioning, former retired hospice nurse herself, was asking everybody that she could talk to. So the entire, she was in assisted living, everyone in that facility, in terms of the facility staff, the director of nursing at that facility, the caregivers at that facility, everybody knew she was begging that she wanted to be palliative sedated. She was using the terms knocked out and left in a sleeping state until the die of palliative sedation. Legal in all 50 states. Legal in all 50 states. I talked to the patient, did the education. She was in emotional distress. It wasn't pain. She wasn't in respiratory distress. She was in emotional distress, which is a qualifying factor for using palliative sedation. Because emotional distress counts as a symptom. Please, I cannot educate enough on this topic. Do not put emotional distress under the bus. Please, I beg of you. If you're in this field, emotional distress, you don't want them committing suicide. You don't want them walking that journey. You don't want them in despair because you put some type of legalistic, judgmental system in a box. Palliative sedation is legal in all 50 states. So the patient wanted it. I talked to the daughter who's the POA, and yes, the patient was in the right mind, can make her own decisions. But I believe in group effort. It takes a village. Let's do this as a team effort. Daughter's perfectly fine for it. All of the LPNs at the facility were okay with it. All the caregivers at the facility are okay with it. The director of nursing, who had to sit down face-to-face, was okay with it. I expressed I would initiate it. I would stay as long as it took to initiate it. I would educate the staff of how this is not euthanizing. I would be the nurse. I would ask to be able to come in 7 days a week, and I would stay the course. I couldn't do their 7 by 24. I'm not a robot. But I shared what it was in my capabilities that I would do. I told everybody, including the patient, I cannot guarantee that this will be allowed. I said, I have to go up the chain of command. I had to get all of the yeses from everybody. There were only 2 yeses to go at the end of the day, so to speak. I'm not talking the physical business end of the day. The director of nursing told me she had to get the okay from the owners of the assisted living. And after we got that okay, then and only then I would go to the hospice medical director. Any of you who are in the nursing field, you know you do not go to the doctor with your recommendations if anything is missing. Some doctors will be kind to you and educate you that you don't do this again. But I've had doctors whiplash you. How dare you waste my time because you don't have ducks in a row, and getting the orders in place, for example, if the facility doesn't allow it, wastes everybody's time. So it's only had those two pieces, but once I was that far, I was comfortable going to our team because this is busy. I could not type up the email. Like I'm busy talking to people. And if you're talking, you remember we talked about listening. If you're talking, you're not listening. Well, I'm talking to different people and I am listening to them, but I can't be typing an email and listening to them and giving them my full attention and typing an email at the same time. So after I got everything but the last two, I emailed our team. And in less than a minute, my clinical manager called me and was screaming her head off. How dare I? How dare I go that far? This was lifelong hospice and palliative care. I don't mind naming because it's the truth. How dare I cross that bridge? How dare I? We might do that someday, but not now. How dare I? It's legal in all 50 states. And how dare you? How dare you throw the patient under the rug? How dare you put your will, your faith, your belief systems, your judgment against that patient who is in emotional distress and had an ethical, legal way out. But you had the audacity to judge me and say, I crossed the road. Now, yes, I have forgiven you, and I'm working on keeping that in the practice. But forgiveness does not mean turn off the memory system and wipe it from the drive. God can do that. I am not God. And I pray on a regular basis for forgiveness. But the patient advocacy means that the patient gets what is legal, ethical, and moral for them to give. And that is not your place to make that decision. That was the doctor's place if we got that far. And I got called in and I was let go that day. And there's one of the first videos of this channel. Was I let go because of that? Was I let go because in early May, the family of a glioblastoma, very young patient, very healthy before this event, asked me, what happened? He's so healthy. We wouldn't have known unless he got into this motorcycle accident, what happened. And I shared with Dr. Patrick Gilhole, a reputable local York County, Lancaster County doctor, said about an injectable product side effect that we're seeing. It's not a medical term. Turbo cancers is not a medical term, but we're seeing a rapid rise of very rare cancers, and said, I don't know, but it could be this. So I don't know. Was I fired because of that? Was I fired because of my age? I'll never know. But getting back, this is still part of the story why end-of-life doulas need to be cautious of working for a hospice provider as an employee, is they could tell you what to advocate for and what not to. They can tell you, and they're not going to word it in a way, and I'm not saying that hospice is bad. Please do not take this the wrong way. There are hospice agencies out there that are for palliative sedation. I've worked for several because it is legal in all 50 states. It is legal. It is not euthanizing. Educate yourself before you scream somebody off through the roof and then fire them. Educate yourself. It is legal in all 50 states. It is ethical. It should be a last resort. This was not done in jest. It was not rushed. All the conversations that needed to happen, happened. And emotional distress is one of the criteria. And it could be the only criteria. You don't need, this is not a multi-checklist. It could be any of the symptoms for GIP fit palliative sedation. Any of the symptoms for GIP fit palliative sedation plus emotional distress. So in this particular patient, I know I'm staying on this topic possibly too long, but I do want to complete the education portion. This person's physical symptoms were as well managed as humanly possible. And yes, I am biased. But if we were to have increased any of our medications any more, we would have crossed the line into palliative sedation. Could I have kept my mouth shut and just went down that road and not have any of the conversations? Yes, I could have. But that's not me, because I believe in being transparent as part of my ethics, transparent as part of my value statement. But as end-of-life doulas, you're not going to be dealing with the medications, but do you want a hospice saying don't have discussions on VSED that is also legal in all 50 states? Don't tell the patient that there's a way to qualify for hospice, because there is, if they want to do VSED. Oh, don't talk about palliative sedation even though it's legal. And oh, we have the relationship here with these group of funeral homes, so don't bring up after death care. And granted, there are fine lines. We have to be very careful. Know your state laws. I'm not giving legal, financial, that type of advice. Know the laws for your area of practice. But you do not want somebody saying you have to leave in 45 minutes to an hour. This is your handbook of what you can and cannot discuss. Because if we work for hospice providers, there's a potential that that would happen. There's a potential that that would happen. You be you. At the end of the day, we all need to get paid. So you might be going, Peter, I'm not able to sell my market, but I have this hospice providers willing to hire me. We've had a discussion, go over boundaries, and I'm going to keep careful watch to make sure that they allow me to operate within the full scope of my practice. I am rooting for you. Please comment. I'm rooting for you. I'll pray for you. I'll help you any way I can down that journey. But that was the 3 points if you're wanting to be a doula. The next point out there is just the last part of it is get out of your comfort zone. Get out of your comfort zone. You can and you will make a difference. If you've taken this long watching, I cannot thank you enough. I know my videos tend to go very long. I'd love to give you a promise that won't happen again, but I know I tend to be verbose. I do better when I prepare for presentations, which are not, there's no teleprompter, but I will write out a presentation. I'll script everything and I'll practice several times a week until I have everything memorized. These are not those type of videos. Maybe down the road, but those I can, oh, you need to do this in 15 minutes or less. This is from my heart. I don't think that could be on a timer. I do thank you for taking the time for watching. Please comment if you have any questions. I appreciate hearing your point of view. Take care and bye.